Hi, I'm Dr. Mike McInnes. I'm one of the chief educators at Doctors in Training, and I want to welcome you to this solid anatomy lecture on the intrinsic muscles of the back. Now, I'll be back later for some clinical correlations and the end of session quiz, but right now I'm going to turn things over to our primary lecturer, Dr. John Phelan.
The muscles involved in controlling movement of the axial skeleton, namely the skull and the vertebral column, are the axial muscles, or the intrinsic back muscles. They receive motor innervation from the dorsal primary rami. They are encased in deep fascia that has multiple attachments to the vertebral column and the ribs. From lumbar to thoracic levels, the deep fascia forms the thoracolumbar fascia, which extends laterally from the spinous processes and forms a thick covering for deep muscles in the lumbar area, and is a site of origin for a superficial muscle of the back, the latissimus dorsi. Superficial back muscles, which act on the appendages and are thus appendicular muscles, will be covered in the solid anatomy lectures on the upper extremity. The splenius, named for the Latin word for bandage, which describes its shape, originates at the nuchal ligament and the spinous processes of C7 through T3 or 4. Its cervicis portion inserts on the transverse processes of the C1 to C3 or 4 vertebra, and its capitis part inserts on the superior nuchal line of the occipital bone. Acting together, the left and right splenii extend the head and neck. Acting alone, each splenius will laterally flex the head and rotate it to the side of the active muscle. The largest muscle group in the human body is the erector spinae. It fills the area between the spinous processes of the vertebra and the angle, or curved part, of the ribs. The three muscles that make up this group are, from lateral to medial, the iliocostalis, the longissimus, and the spinalis. They have a common broad tendon of origin that attaches to the posterior part of the iliac crest, the posterior aspect of the sacrum, the sacroiliac ligaments, the inferior lumbar spinous processes, and the median sacral crest. Each erector spinae muscle has three segments. The iliocostalis lumborum and thoracis insert on the ribs, while the iliocostalis cervicis inserts on the transverse processes of cervical vertebrae. The longissimus thoracis and cervicis attaches to the transverse processes of the thoracic and cervical vertebra and to the ribs, but the longissimus capitis inserts on the mastoid process of the temporal bone in the skull. The spinalis thoracis and cervicis insert on the spinous processes of the thoracic and cervical vertebrae, while the spinalis capitis inserts on the occipital bone in the skull between the superior and inferior nuchal lines. Acting together, the left and right erector spinae extend the head and the vertebral column. Acting unilaterally, they laterally flex the vertebral column.
Welcome back. I want to take a break here and talk about something you're bound to run into in your medical career, if not already as a patient, and that's back sprains and back strains. Now, it may seem a little dull, but back injuries and back pain in general are extremely common, so you will see a lot of this, even if you practice as a cardiologist or an ophthalmologist or whatever. Unless you're a radiologist or a pathologist and you never see patients, you will see back pain. Even if it's just friends and family that ask for your opinion. You can't say, I'm an ophthalmologist, I don't take care of anything south of the nose. People are going to see those letters behind your name and expect you to be able to give them some basic advice. So first of all, let's clear up a few language issues when it comes to back strains and back sprains. A sprain of the back is going to be associated with an injury of the ligaments that hold the vertebrae together. The major back ligaments, like the anterior and posterior longitudinal ligaments, interspinous, supraspinous ligaments, are all discussed in the deep back lecture entitled Bones, Joints, and Ligaments of the Spine. So a back sprain is a ligament injury. A back strain, on the other hand, is either a tearing or an overstretching of a back muscle or a muscle tendon unit. Common terms that might be used to describe both sprains and strains are mechanical back pain or musculoskeletal back pain. However, the term mechanical back pain can also refer to degenerative changes of the intervertebral discs and facets, or dysfunction of the nerve roots like herniated discs or narrowing of the spinal canal, which will not be discussed here. But be aware of these terms mechanical back pain and musculoskeletal back pain because they're sometimes used interchangeably with back sprains and back strains. Now, back strains normally occur with the intrinsic back muscles, specifically the erector spinae, but they can occur with the superficial back muscles, like the trapezius. Normally, the muscles affected in a back strain act on the intervertebral joints when attempting to use the back like a lever, maybe in lifting something heavy. This lifting action puts excessive tension on the back muscles and can lead to a strain of the muscle or a strain of the ligaments. Now, because a fair number of back sprains and strains occur because of this lever action, it's recommended to keep the back as straight as possible when you're lifting something heavy. You've heard it a million times, lift with the knees. Now, unfortunately, when a patient comes in to see you with a back injury, it's too late for the lift with the knees advice to be much help. But it is a great time to address proper lifting technique because now they're hurting. Maybe now they're going to actually listen to you. It's like telling the guy with lung cancer to quit smoking. It's too late, but maybe this time he's scared enough to actually listen to you. So if someone injured their back because of bad lifting technique, take a moment to educate them, especially if the patient injured himself or herself on the job and he or she is self-employed. For the most part, if the patient works for a large corporation, proper lifting techniques are covered in training, but when a worker is self-employed, he or she might not have the luxury of having preventive education on proper lifting techniques. Now, there's not been overwhelming proof that using a back belt reduces the occurrence of lower back strains. However, patients will use these back belts for lumbar support. Now, it might be the case that wearing these for long periods of time will actually weaken the back muscles, so you should recommend using these belts only when bending and lifting, not simply all the time. This brings up another good prevention point. One of the other ways to prevent back sprains and strains is to have strong core muscles. Strong core muscles serve as physiologic back support, adding stabilization to the vertebral column. Proprioceptors found within the muscle spindles and also Golgi tendon organs within the skeletal muscles can disrupt motor control if they're damaged, and this can ultimately interfere with the stability of the spine and lead to chronic back pain. Also be aware that low or lumbosacral back pain is very common because the lumbar and sacral spine, specifically L4, L5, and L5, S1, is responsible for most of the mobility of the spine and the trunk. Now, we're going to discuss more treatment options for back sprains and back strains in the next clinical correlation toward the end of the lecture, but let's answer these questions for now, and then I'll let Dr. Phelan finish talking about the intrinsic back muscles. So the question in your study guide says, what's the difference between a back strain and sprain? Again, a back sprain is an injury to the ligaments holding the vertebrae together, and a back strain is tearing of the muscle or overstretching the muscle fibers in the back muscles. Then the next question says, what should be the position of the spine while lifting a heavy object? You want to maintain a straight spinal position and avoid flexing or extending or rotating or laterally flexing the spine. Keep that back straight and lift with the knees. All right, let's get back to Dr. Phelan.
Deep to the erector spinae, occupying the space between the transverse processes and the spinous processes of the vertebra, is the transversospinalis group of muscles. The three muscles in this group, from superficial to deep, are the semispinalis, the multifidus, and the rotatories. The semispinalis has thoracis, cervicis, and capitis parts, the latter being the largest. They originate from the transverse processes of C4 to T12 and insert on the spinous processes of cervical and thoracic vertebra, except for the semispinalis capitis, which inserts on the occipital bone. The semispinalis muscles extend the head and thoracic and cervical regions of the vertebral column and rotates them contralaterally. The multifidus is thickest and best discernible in the lumbar region. It originates at the posterior sacrum and the articular and transverse processes of lumbar, thoracic, and cervical vertebra and inserts on the spinous processes. The multifidus assists in stabilization of the vertebral column, but its principal action is said to be posterior sagittal rotation, a tilting movement of the vertebra during extension. The rotatories muscles originate on the transverse processes of the vertebra and insert on the spinous processes of the vertebra 1 or 2 segments superior to the vertebra of origin. They are involved in rotation and stabilization of the vertebral column. The deepest group of intrinsic back muscles is sometimes referred to as the deep segmental muscles. These include the interspinalis, the intertransversarii, and the levitories costarum. As their names suggest, the interspinalis and intertransversarii span adjacent spinous and transverse processes, respectively. Their actions are relatively minor, but some have suggested that they are involved in proprioception, that is, the unconscious sense of the position of the vertebra relative to each other. The levitories costarum originate at the transverse processes of the C7 to C11 vertebrae and insert on the 12 ribs just medial to their angles or curved regions. These muscles assist in elevation of the ribs during respiration and assist in lateral flexion of the vertebral column. Finally, there is a group of 4 axial muscles deep to the semispinalis capitis that attach to the skull, the atlas, and the axis. They are the rectus capitis posterior minor, the rectus capitis posterior major, the obliquus capitis superior, which is also called the superior oblique of the head to distinguish it from the superior oblique of the orbit, and the obliquus capitis inferior, or inferior oblique of the head. The latter 3 muscles form the suboccipital triangle. The rectus capitis posterior minor runs from the posterior tubercle of the atlas to the inferior nuchal line. The rectus capitis posterior major attaches to the spinous process of the axis and the inferior nuchal line. The obliquus capitis superior runs from the transverse process of the atlas to a region on the occipital bone between the superior and inferior nuchal lines. And the obliquus capitis inferior spans the spinous process of the axis and the transverse process of the atlas. These muscles extend and rotate the skull. They are all innervated by the dorsal ramus of C1, which is named the suboccipital nerve, and, unlike other dorsal rami, has no sensory component. The dorsal ramus of C2, which is named the greater occipital nerve, has no motor component. The remaining dorsal rami of the spinal nerves do not have individual names and carry both motor and sensory axons. The suboccipital nerve arises deep in the suboccipital triangle, while the greater occipital nerve emerges from the inferior border of the obliquus capitis inferior and then ascends towards the scalp, crossing the posterior surfaces of the muscles of the suboccipital triangle. Another structure found deep in the suboccipital triangle is the vertebral artery, which passes through the transverse foramen of the atlas and turns medially to run in a groove on the superior surface of the posterior arch of the atlas on its way to the foramen magnum.
So that finishes up the various intrinsic back muscles. Now let's touch on the treatment for back sprains and strains before moving on to the end of session quiz. Before you begin thinking about treatment, you first want to make sure your diagnosis is correct. If someone has back pain that does not fit the picture of a sprain or a strain, you don't want to just write it off as a strain or sprain. For instance, if the patient has fever and back pain, it's probably not a mechanical back injury, but maybe they have a kidney infection or meningitis or something like that. If they have neurological symptoms like weakness in the legs or pain or numbness or tingling that radiates down one leg, that might indicate a pinched nerve or some other neurological injury. So remember that not all back pain can be attributed to a sprain or a strain. But if the clinical picture points toward a mechanical back injury, there are several treatment options. One is rest, or at least limiting excessive range of motion of the spine. You can also use nonsteroidal anti-inflammatory drugs like ibuprofen or the brand name Advil. This might be even a good time to think about using an injectable intramuscular nonsteroidal. Muscle relaxers also play a role in the treatment of mechanical back pain. A muscle or muscle group of the back can involuntary spasm in response to ligamentous weakness in a sprain injury. So some patients might benefit from a muscle relaxer to calm the muscle spasm down. Another take-home point is that sometimes back pain will require further evaluation, such as x-rays or an MRI. So if a back sprain or back strain is not improving after 3 to 4 weeks, you want to reconsider your diagnosis and maybe go back to the drawing board. So the question in your study guide says, what are some treatment options for a back strain or sprain? So rest, ice in the acute phase, and then heat and ice in the recovery phase. So ice is good for acute inflammation, just like if you roll your ankle, you can ice it to reduce the swelling and the inflammation. But then after the acute injury has passed, heat can help the muscles relax and prevent some spasm. So patients can alternate heat and ice, or I usually just tell them to use whichever one makes them feel better. We didn't mention this, but physical therapy is also very helpful, either a home physical therapy program or going to an outpatient physical therapy facility, depending on the severity of the injury. We mentioned NSAIDs, or nonsteroidal anti-inflammatory drugs. We mentioned muscle relaxants, and then pain meds in some situations, and we're talking about narcotic analgesics, the strong stuff. But you want to be careful with these because back pain is a common complaint for patients who are just looking to score some pain meds for a quick high. And then we also discussed the importance of prevention and education and proper lifting technique to avoid future back strains and sprains. All right, now it's time for the end of session quiz. So pause the video, answer all the end of session quiz questions, and then restart the video and we'll go through those together. All right, let's get started. First question, from where do intrinsic back muscles and superficial back muscles receive their innervation? So the axial or intrinsic back muscles are innervated by the dorsal primary rami, and the appendicular or superficial back muscles are innervated by the ventral primary rami. Next, what's the action of the erector spinae muscles? So acting bilaterally, the erector spinae muscles extend the vertebral column in the head, but if they act unilaterally, they laterally flex the vertebral column. Next, what's the name of the thickest muscle in the lumbar region of the intrinsic back muscles? It's the multifidus. Next, what muscles span adjacent spinous processes? These are the interspinales muscles. And the next one, what muscles span adjacent transverse processes? These are the intertransversarii muscles. Next, what are the muscles that make up the suboccipital triangle? You have the rectus capitis posterior major, the obliquus capitis superior, and the obliquus capitis inferior. Next, which intrinsic back muscle plays a role in respiration? It's the levator costalis. It elevates the ribs. Next, which dorsal rami have no motor component and which have no sensory component? So the dorsal rami of C1 have no motor component and the dorsal rami of C2 have no sensory component. Next, which artery crosses the suboccipital triangle? That's the vertebral artery. Next, what's the deepest group of intrinsic back muscles? It's the deep segmental, or the interspinales and intertransversarii, and then also the levator costarum. All right, now you're ready for your mock practical. So we have some images for you to label. Labeling these images in a time setting is going to help you prepare for your practical exam. So label the images, and then you're finished.